Eligibility requirements cover the basic structure and services of a CoC-accredited cancer program, elements common to all programs. These are core components essential for the provision of comprehensive care and to the success of a CoC-accredited cancer program. Cancer Committee is responsible for oversight of the eligibility requirements. This includes the annual monitoring and assessing of each eligibility requirement. The annual review is an opportunity to identify needed changes, enhance services, expand coverage, and address issues and gaps. The membership of Cancer Committee should be involved in the annual assessment, program coordinators, nursing and rehabilitation departments, quality assurance subcommittee, and others as needed. The annual assessment is a time to ask questions such as, are the services adequate for patient needs? What services might be missing? Are the services used, over versus underuse? Is access to service easy? Is there enough staff to provide adequate services? The annual assessment is documented in Cancer Committee minutes. Before a survey, the CoC-accredited program updates the ER section of the SAR and uploads appropriate documentation. This activity could be used as a cue to perform the annual assessment by Cancer Committee. This information is reviewed by CoC annually. If one or more eligibility requirements are not met, a period in which to resolve the requirement is granted. If not resolved, the accreditation status will be suspended and no survey will take place. Eligibility Requirements, Part 1, Structure. E1, Facility Accreditation. The facility must provide documentation of accreditation certification from a recognized federal, state, or local authority appropriate to the facility type, such as Joint Commission or equivalent, Accreditation Association of Ambulatory Healthcare, DNV Healthcare, Inc., or other recognized authority. This association ensures the program is providing a safe environment and defines boundaries for accredited programs. E2, Cancer Committee Authority. The facility formally assigns the authority and responsibility for the cancer program to Cancer Committee through a bylaw, policy or procedure, directive, or charter. Cancer Committee is responsible for goal setting, planning, initiating, implementing, evaluating, and improving all cancer-related activities. The facility provides a copy of the documentation. E3, Cancer Conference Policy. The program develops a policy or procedure that addresses cancer conferences in a formalized structure to ensure patient consultation and physician education. The policy addresses the frequency and format of conference, multidisciplinary composition and attendance rate, prospective and total case presentations, 15% of annual caseload, and 80% prospective discussion, discussion of stage, prognostic factors, treatment planning, using evidence-based guidelines, options for clinical trials, how deficiencies will be addressed. A current version of the policy will be provided. E4, Oncology Nurse Leadership. A nurse is the leader for oncology patient care across the continuum. The nurse manager leader ensures that nursing policies and procedures for cancer patient care follow Oncology Nursing Society or other recognized organizational standards and guidelines. The nurse leader is identified by the program. E5, Cancer Registry Policy and Procedure. The Cancer Registry Policy and Procedure Manual specifies that current CoC data definitions and coding instructions are used when describing reportable cases. The registry policy or procedure addresses all areas of registry operations. Content may include CoC data standards and codes, reference date, abstracting procedures, follow-up system and methods, state registry reporting requirements and procedures. The table of contents of the most recent version of the manual will be provided to CoC. Thank you for viewing this video on the CoC standards, and remember to view the remaining videos in this series to further increase your knowledge on the standards. For additional resources, be sure to visit the CoC website at www.facs.org/cancer to access the CoC Educational Portal, Best Practices Repository, and Cancer Forum.